So as mentioned before, this condition is really a result of a muscle spasm on one side. And that muscle spasm could be occurring in a few different muscles, but two of the ones that we commonly see are the levator scapula muscle, which we have both of them kind of drawn here, and the upper trapezius muscle. So both of these muscles are involved in either motion of the shoulder blade or motion of the neck. As both of them are also inserting in that basically shoulder blade and throughout the neck. So as we mentioned, rotating the head is going to be difficult and challenging, but also palpating and touching through these muscles are also going to be a little bit uncomfortable just as a result of the muscle spasm. Something that we may feel for are trigger points or muscle knots that you may even identify before coming into the office. And when we press those specific areas, those may be a real source of tenderness. And those are going to be areas that we really focus on with our treatment in the manual therapy. So one of the manual therapies that we may provide is dry needling. It is a common treatment that we use for trigger points or for muscle spasms. I'm going to show you a little bit of what we would do, but as mentioned, these muscles are really the primary muscles that we find are the source of the issue. So as we palpate through here, we may be feeling for areas of tension or really just knots or trigger points, right? So when we do find those, that is going to be where we place the needle. So I have one right here with Todd in his upper trap, and that's basically right where I'm going to place the needle. And sometimes you may feel even a twitch response or an involuntary contraction when we're inserting that needle into that trigger point. It's usually a good thing because a lot of times that leads to almost an immediate reduction in that muscle tension, which can help relax that area and bring about a little bit of pain relief. Once we have these needles situated, we can just leave the patient here with those needles in place. That can lead to a sort of healing response to that area. Or another thing we may do is attach a TENS unit to this, to the needles to produce a muscle contraction, which after a period of time can help relax that area and really bring about some relief and improved range of motion. So we'll kind of show you what that looks like here in a second. Okay, so we have the needles situated and the TENS unit attached to those needles. And as I mentioned, we may be focusing on the upper trap, which is where we have them placed currently. Or if we identify that the levator scapula is a little bit more involved, then we may focus on that muscle group. But we situated the needles specifically in some trigger points that we found throughout that muscle. And then we are going to turn on the TENS unit, which is basically going to provide muscle stimulation through that electrical impulse and allow those trigger points to kind of resolve and also the overall muscle tension in that muscle to reduce. That will help with pain and range of motion. As we turn this on, you may start to see the muscle start to contract. And that's really what we're going for with this specific treatment and therapy. If you haven't had this therapy done before, it may feel a little funny because those muscles are actually contracting on their own. But over time, over about 3 to 5 minutes, typically you become adjusted to it, and it's a very tolerable and comfortable treatment and produces a lot of good results and significant effects. So if you want to zoom in here. So aside from the dry needling, we also might do a few other manual therapy techniques. And the whole goal of this is just to reduce that muscle spasm and the tension within the muscle group. So we may also do a little bit of manual therapy like light massage or even some cupping. We won't show that, but those are some things that we might add in conjunction with the dry needling. Another thing that we may do is a traditional chiropractic adjustment. As the patient comes in, they may have, like we've mentioned a few times, is they may have restriction in one range of motion. So what we're really trying to do is restore that range of motion because that's usually what impacts their daily activities. Driving, looking over that shoulder. So if we imagine that Todd came in and the issue was on the left side, like we treated in previous videos, he is more than likely going to have very difficulty or trouble with rotating that head to the left. So the goal of our adjustment may be to restore that range of motion or return that range of motion to the left. So we may have trouble adjusting in one direction, but what we're really going to try to accomplish is moving the head into a rotational position. If you've had an adjustment before, those are kind of the things that we're thinking about. We're not just trying to crack the bones or create that pop, but we're really trying to restore segmental function within those joints. And so if there's restrictions going to the left, we are going to adjust to bring about range of motion in that direction. So with Todd, we have assessed, and there are a few restrictions on the right side, but we are going to bring that head to the side, and then this adjustment will be purposeful in restoring that range of motion and enabling him to look over that left shoulder.